Hi guys, this is Dr. Raj. This week I really wanted to do this video on generalized anxiety disorder, and I also want to touch upon panic attacks. I think at this current time, as we're all in this lockdown during this pandemic, more and more patients are experiencing anxiety and also having more frequent episode panic attack. And some patients do have underlying anxiety disorder or panic disorder, and they're seeing the stress level has caused these episodes to be much more higher. But I'm also seeing patients that are coming in with new symptoms and having a new diagnosis of this. So the key thing is that I want to cover here is to talk about some of the symptoms that you would expect if you are having an anxiety attack. So normally what we do if patients comes in with their concern, we have a screening test. It is a 2-component test. First part is for depression. It's called the PHQ-9, and then you have the GAD, which is a generalized anxiety disorder. So today I just want to talk about the bottom part because that's the one consistent with anxiety, and it has about 7 questions. I will link that screening form to the to this video. If you feel like you need to do that test, you are more than welcome to do so, and then bring it up with your primary care physician. So in that 7 questions, what they're trying to ask you is that, do you feel nervous? Do you feel like you're anxious and always at the edge? Are you not able to stop worrying, or you're worrying too much about multiple things that are around you? Do you have trouble relaxing or sitting still? Do you feel restless? Sometimes people are more annoyed about everything. And are you afraid something awful is going to happen? So these are the 7 questions, and you're answering based on the last 2 weeks, right? Just to give us a time frame. And depending on how you answer these questions, we can formulate a score. And if your score is less than 5, that means it's pretty much normal. But if your score is anywhere greater than 16, that's considered pretty severe anxiety, and anything in between, you have mild and moderate. So if you're in that moderate to severe, you should be definitely starting on medication as a form of treatment. When you're in the mild category, you can don't need to be on treatment, but you can if you wanted to, but therapy should be initiated. But you should be doing combination of medication and therapy towards the end of high scores. So this is how we go about doing them. And right now, a lot of people are feeling these symptoms because during this lockdown, everybody is given rules to follow, right? When you're leaving the house, you have to wear a mask. You have to make sure you have proper hygiene care in the car or outside, and you have to socially distance yourself as much as you can. These simple rules definitely brought a lot of anxiety in patients, and people are very anxious to leave their house and even to do a grocery shopping. And even just with grocery shopping itself, a lot of people have high anxiety because how many people are going to be around you and bringing back groceries that may be contaminated, or they're afraid it might have the virus, which very low risk of transmitting. But those are simple things that actually causes people's anxiety to go up. And then those that are in healthcare field, their anxiety is going up because they're afraid they might come in contact with somebody that have the virus and they can be COVID positive. So it is very common to see the anxiety come in many different forms, and it's also happening in various age groups. I am seeing anxiety play big impact in young kids because they are in no school, they're at home, they're seeing the same parents, they're seeing the same siblings, and they're in the same environment almost every day for the last 4 months. So that is affecting their sleep, their eating habits, and their behaviors. I'm also seeing the anxiety in young kids as well as adults, especially adults that are working in this current time, either be healthcare or non-healthcare related. They're also facing a lot of stress. And don't forget the elderly patients. They're facing a high level of anxiety because they are living on their own and they really don't have that moral support from their kids who can come in and visit them. Even if they're keeping a distance, which really doesn't give a close connect. And that's causing a lot of elderly patients to be at the edge. So be aware of it, and it's very simple to talk to your doctor about and undergo the screening. And if you feel like you need to start the treatment, you do so. The other thing that I want to touch is the panic attack. So panic attacks are basically you are having like a spontaneous episodes where you have that intense fear of something might going to happen all of a sudden very quickly. You might have a trigger, but it can also happen like I said, spontaneously without any warning. Very common trigger is obviously the stress. And what these people may feel is that they will describe as their heart is beating really fast. They feel like the heart is coming out of the chest. They feel the chest tightness or chest pain or chest discomfort. They also complain they have difficult time breathing. Sweating is very common, shaking, having tremors. Some people actually faint or have dizzy spell, or they feel they're lightheaded or dizziness. All of these are very common symptoms they will describe during their panic attack. For some, it can happen within a minute and then it will resolve on its own. For others, it could last for at least an hour. Some people are able to have a coping mechanism where they're able to breathe through it and come out of those attacks, but some people cannot, and it leads to a lot of complications where they bring into the hospital and they need to be treated. So with panic attack, yes, you can treat it without medications, but if it's too severe and it's happening more frequent, you should be on a medication that's baseline to help with your nerves, but also have a medication as needed when you're having those attacks and you cannot control it yourself. You should be able to take that medication on an as needed basis. Those who does not want to go down the route of taking medication, simple things you can do is reduce your stress level. So, which means you have to take care of yourself. So going from being healthy in general, try to eat healthy food, more nutritious food, more whole foods, foods that have more nutritious value like vitamins, the minerals. Drink a lot of water. You should be drinking water throughout the day to flush out all the toxins out of you. Try to relax your mind either by doing meditation or yoga, or if exercise is your way of relieving your stress, then you want to walk or run or get on an elliptical or whatever that you like to do for at least 30 minutes. Some people like to write journaling. That's their way of de-stressing. Like, do whatever that obviously works for you. So these are key things that symptoms you want to look for if you're having a panic attack, and bring it up to your physician. The personal story I can share with you, even though I'm a physician, when this COVID did actually hit and it took a toll in my work and in my house, I definitely had an anxiety because of how am I going to work and have my child at home, because obviously daycare was a question at that time. And for some people, like for me, I was watching a lot of news watching news all the time, every day, does increases your anxiety. If you just want to be up to date and know what's going on, watching it once and turning off the TV is the best way. And stop trying to be on social media too much, because you will definitely have a lot of newses that can cause a negative impact in your life, and it will definitely affect your mood, increase your stress, and then it leads down the lane for everything else. So try your best to reduce your stress level, and if you are having any of the symptoms I talked about, feel free to bring it up to your physician and have a discussion. And if treatment is an option, then you should be taking those medication. I hope this video was helpful as far as talking about anxiety and panic attack in short version. If you guys have any questions or you want to share your personal story, feel free to do so below this video, and share to anyone that this might be useful to them. Thank you.